ending isolation and assessing information. Accessing.
What we're saying is that often the people who need most information have got multiple pathologies and they're likely to be older. And so, but the problem is that they haven't got computers often, and they're computer phobic. We've all around the table admitted to having computers that they're perfectly workable, but we don't use them anymore. We've got thinner, faster, more slicker computers. So the idea is that we would recycle in a free way computers, and we would link it to our Face It Together, which should be our technology, our website. Face It Together. And the idea is that we could collect these computers from companies, from individuals, and the Face It Together would be the home page. And we talked about asylum seekers and other people who could perhaps train and support people in the development of their use of the tool. And within it, we'd have some sort of Google map. Do you want to tell them about Google Map, Lauren?
Yeah, maybe the idea of kind of keeping everything a bit local, so being able to type in maybe your postcode with a 10-mile address, of maybe all the both professional and personal support that's available in your area, being very aware that these people would be the types that would be a bit and have quite a lot of anxiety around technology.
Well, the problem was that we're trying to solve was people going into hospital in an emergency without their own clothing, without any relatives maybe at home, and without anybody really knowing who they were. And so we've called it where'smybag.com. and the technology we were going to use was...
we started off with clothes, but we we went on more or less covered loads of things about stuff like issues, what cover dignity, about what you like to be called and what you want to wear when you're in hospital and stuff like that, or in a care home or something like that.
We were saying, first of all, we need to identify the need to make sure there was some baseline information so we knew there was a definite need. Publicise it, get information out there, maybe on the TV, internet based, so people know this is where my bag is and this is who I am. So people realise, relatives or people in the hospital, where they can go, who they can get the information from.
Welcome to Dying to Know, which is a site a bit like Mumsnet, where people who are in some way involved in end-of-life care, so that could be either if you know you're dying or someone you care for, carer, or live with, loved one, relative is dying. It's a site where you can get support, information, guidance, and just basically peer support from others. So it would be a site that had forums to discuss issues and ideas and thoughts, but also lots of factual information about the issues around dying and the issues, what support you can expect to receive, information about drugs, what's a good death, bereavement support, a whole load of different information, guidance and support for people who are involved in the final processes of someone dying.
We think that the health service would save money out of this, because I think the evidence is that if you give people more information, more options, actually they're less likely to choose a whole load of very expensive interventions at the end of their life.